Welcome to the 2026 AMB-BC Ambulatory Care Nursing Exam Prep course, designed to help you pass your certification on the very first try. We will break down the most important topics using simple, clear words, so you can easily absorb the material. Our learning method is straightforward: train, test, fix, and repeat, ensuring we learn from every single mistake along the way. These practice questions come with full explanations, and I will be here to guide you through every step of this journey. In ambulatory care, we treat patients who do not stay overnight, which means we must be fast, accurate, and deeply committed to patient safety. You will master critical everyday skills, such as quick assessments, telehealth and phone triage, and teaching patients how to safely manage their care at home. We will also cover the management of chronic illnesses, strict infection control, and the golden rule of nursing documentation. Always remember, if it is not documented in the patient's chart, it simply never happened. As we dive deeper into the material, you will learn about current vaccine schedules, allergy checks, and the importance of respecting diverse cultures. We will discuss why you must always use a professional medical translator instead of a family member, and how to collaborate with social workers to navigate resources like Medicare and Medicaid. To start your learning journey right now, please subscribe to the channel, and make sure to get the full course using the link in the description below. 1. What is the most important step before you give a patient a new vaccine? You must always ask the patient about any past allergic reactions to old vaccines. Checking for severe allergies stops bad reactions, keeping the patient safe before the injection. 2. Why do we tell nurses to use professional interpreters instead of a family member? Family members might not know medical words, causing very dangerous mistakes in patient care. Professional translators understand difficult medical terms, which helps prevent errors and protects patient safety. 3. What does telehealth triage require a nurse to do over a regular phone call? You must listen carefully to symptoms, decide the urgency, and give the right advice. Because you cannot see them, listening for breathing changes or pain levels is the key. 4. How does proper patient education reduce the number of hospital visits over a year? Patients learn how to manage their disease at home, keeping them out of hospitals. Teaching them about their medications and diet helps them stay stable and feel better. 5. What is the main reason we document every single detail in a patient chart? If a nurse does not write it down, the law says it never happened. Good notes protect both you and the patient, serving as proof of the care given. 6. Which chronic illness requires patients to check their blood sugar levels at home daily? Diabetes requires regular blood sugar testing, along with a healthy diet and proper medicine. High or low sugar levels can cause severe damage, so monitoring it prevents big problems. 7. When should an ambulatory care nurse wash their hands to prevent spreading any infections? You must wash your hands before and after touching every single patient you see. Clean hands stop germs from moving around the clinic, protecting you and sick people. 8. What is the best way to make sure a patient understands your discharge instructions? Ask the patient to repeat the given instructions back to you in their words. The teach back method confirms they know exactly what to do when they get home. 9. Why do ambulatory nurses need to know the schedules for child and adult vaccines? Giving the right shots at the correct time protects communities from very bad diseases. Vaccines build immunity against viruses, which keeps vulnerable people safe from serious illness outbreaks. 10. How can a nurse help a patient who cannot afford their high blood pressure medicine? You can connect them with a social worker, who will find helpful financial resources. Social workers know about community programs, which help poor patients get their needed treatments. 11. What action should you take if a patient refuses to take their prescribed medication? You must document their refusal, ask why they declined, and tell the main doctor. Patients have the right to say no, but we must find out the real reason. 12. Why is wearing personal protective equipment necessary when treating a coughing patient in the clinic? Masks and gloves block tiny germs from entering your body, keeping the staff healthy. Protective gear acts as a strong wall, stopping the spread of dangerous airborne viruses. 13. What should a nurse do first when a patient calls complaining of severe chest pain? You must tell the patient to hang up, and call emergency services right away. Chest pain is a huge emergency, and they need immediate help from paramedics quickly. 14. How does an ambulatory nurse support a patient trying to lose weight for their health? We teach them about eating good food, exercising regularly, and setting realistic daily goals. Small lifestyle changes add up over time, helping them lower their risk of heart disease. 15. What is the purpose of checking a patient's health record before they enter the room? Reading their history helps you spot allergies, past surgeries, and any current ongoing problems. Knowing their background makes your assessment faster, allowing you to give much safer care. 16. Why must you keep patient information private and avoid talking about them in the hallway? Sharing private medical details breaks the law, and it ruins the trust they give us. The privacy laws strictly protect personal health data, so we must always keep it secret. 17. How do you assess the pain level of a child who cannot speak very well? You can use a chart with faces, asking them to point at how they feel. Visual tools help kids communicate their pain, which guides you in giving proper pain relief. 18. What is the most common sign that a wound might be getting a bad infection? The area will become very red, feel hot, and might leak a smelly fluid. Redness and heat mean the body is fighting germs, requiring immediate medical attention and care. 19. Why is it useful to review a patient's medication list at every single clinic visit? Doing this catches bad drug mixes, making sure they are taking the right doses daily. Updating the list prevents harmful reactions, keeping the patient safe from accidental medical overdoses. You can find the link to get the full course in the description box below. Welcome back to Section 2, where we will dive deeper into managing clinic patient care. In ambulatory care, you will often help older adults who juggle multiple medications, so it is crucial to review their lists carefully to prevent dangerous reactions. Always take their vital signs first, paying close attention to small changes in their heart rate or blood pressure. If a patient has memory issues, make sure to write their instructions in large letters, and include a family member to help prevent medication errors or accidental falls at home. Next, we focus on health screenings, like blood pressure checks and regular blood tests, which help catch diseases early when treatments work best. You must know normal lab values, reporting any bad results to the doctor immediately, so the patient is not left waiting in anxiety. Alongside physical care, remember that patient privacy is strictly protected by HIPAA laws, meaning you must always close your screen and secure their data. Do not forget their mental health, either. Asking patients about their mood is vital, as anxiety and depression can heavily impact their physical healing. Finally, clinical care requires strong practical skills, like cleaning wounds and applying fresh dressings, while teaching patients how to prevent infections. You will also need strong communication skills, especially when handling angry or upset patients, so remember to stay calm, listen closely, and speak softly. You are doing a fantastic job, and all this hard work will absolutely pay off on your upcoming exam. If you are enjoying this content, please make sure to subscribe, and you can get the full course in the description below before we move on to the next questions. 20. Why do we ask older patients to bring all their pill bottles to the clinic visit? Bringing the physical bottles shows us exactly what they take, preventing bad and dangerous drug mixes. Many older adults get confused by generic names, so seeing the actual bottles confirms the truth. 21. What is the best way to help a patient who forgets to take the daily medicine? We can suggest using a pill box, which organizes their medication by the days of the week. A pill box serves as a strong visual reminder, making sure they do not skip any doses. 22. How do routine health screenings help patients live longer and much healthier lives overall? Screenings catch bad diseases very early, before the patient even starts feeling any painful physical symptoms. Finding cancer or high blood pressure early means the medical treatments will work much more effectively. 23. What should a nurse do when a patient's lab test shows dangerously high potassium levels? You must immediately contact the doctor, because high potassium can cause a sudden, fatal heart attack. Abnormal lab values are treated as emergencies, requiring fast action to protect the patient from harm. 24. Why is keeping the computer screen turned away from the hallway a required nursing practice? Turning the screen hides private health records, which protects the patient and follows strict privacy laws. Anyone walking by could read the screen, causing a severe violation of their personal medical trust. 25. What is the first thing you check when a patient complains about feeling very dizzy suddenly? You should measure their blood pressure immediately, because a sudden drop often causes a dizzy feeling. Checking vital signs gives you real numbers, helping you figure out what is wrong very quickly. 26. How should you clean a dirty wound before you apply a brand new medical bandage? You must use sterile saline water, gently washing away the dirt from the center facing outward. Cleaning from the inside to the outside pushes the bad germs away from the healing skin. 27. Why do we ask patients about their emotional mood during a normal physical checkup visit? Mental health affects physical health greatly, so we must make sure they are not feeling depressed. Anxiety and sadness can slow down physical healing, making it harder to recover from normal illnesses. 28. What is the best way to respond when a clinic patient starts yelling at the staff? You must stay very calm, speak in a soft voice, and listen to their angry complaints. Getting angry back only makes things worse, while staying calm helps reduce the bad tense feelings. 29. Why is it helpful to have a family member present when teaching a confused patient? The family member can hear the instructions, helping the confused patient follow the rules at home. Confused patients forget things quickly, so an extra pair of ears ensures the medical plan works. 30. What should you do if you notice a patient has a very high breathing rate? You must check their oxygen levels with a monitor and ask if they feel any chest pain. Breathing too fast means the body is struggling, requiring you to find the exact hidden cause. 31. How does an ambulatory nurse prevent accidental falls for patients waiting in the clinic room? We keep the floors clean and dry, making sure there are no wires blocking the walkways. Removing tripping hazards protects older patients, who might have weak legs and poor overall body balance. 32. What is the main purpose of doing a regular breast cancer screening for older women? Screenings look for tiny hidden lumps, catching the dangerous cancer before it spreads through the body. Early discovery gives patients the best chance of survival, requiring less painful treatments in the future. 33. Why do we always tell patients to keep their new bandages completely clean and dry? Wet and dirty bandages attract bad germs, which will quickly cause a very painful skin infection. A dry environment stops bacteria from growing, allowing the broken skin to heal smoothly and safely. 34. What action must you take if you accidentally give the wrong medication to a patient? You must check the patient first, and then report the mistake to your medical clinic boss. Honesty is always the best policy, because hiding mistakes can lead to the patient getting hurt. 35. How can you tell if a patient is experiencing severe anxiety during their clinic visit? They might sweat a lot, breathe very fast, and avoid looking directly into your own eyes. The body reacts physically to mental stress, showing you clear signs that they feel very scared. 36. Why is it bad to give a patient medical advice that is outside your nursing knowledge? Giving the wrong advice can hurt them, and it goes against your legal nursing practice rules. You must only teach what you know, asking a doctor to explain things you do not understand. 37. What should you do when a patient speaks a language you do not know at all? You must call a professional medical interpreter, who will translate everything clearly without making any mistakes. Guessing what they mean is very dangerous, so we rely on trained experts for safe communication. 38. How do you properly dispose of a used needle after giving a patient a shot? You must drop the used needle directly into a hard plastic sharps box on the wall. Throwing needles in regular trash can poke someone, spreading dangerous diseases to the cleaning staff members. You can find the link to get the full course in the description box below. Welcome back to Section 3, where we will focus on managing chronic diseases in our clinics. You are doing a really great job so far, and I am very proud of your progress. Today, we will learn how to help patients manage long-term health problems, like asthma and diabetes, by creating realistic, step-by-step plans that they can actually follow. Because patients often see multiple doctors, care coordination is a huge part of our role. As an ambulatory care nurse, you act as a bridge, sharing vital information between specialists and pharmacies to keep the patient safe, and preventing dangerous medication errors, especially during high-risk transitions from the hospital to the clinic. Beyond just treating physical sickness, we must care for the whole person by connecting them with vital community resources. If a patient cannot afford healthy food, or lacks transportation to their appointments, it becomes almost impossible for them to manage their health, so we work with social workers to find solutions like food banks or medical vans. Health literacy is just as critical, because many patients feel completely overwhelmed or too embarrassed to ask simple questions. To help them, you must use plain language, avoid big medical words, and always use the teach-back method, asking them to repeat instructions in their own words so you know they truly understand. Finally, we will look at quality improvement, which is all about finding safer, more efficient ways to run our clinic. Whether it is reporting broken equipment or collecting data to fix long wait times, always share your good ideas with the team, because your voice truly matters. You are now ready for the next questions, so let us practice what we have just learned. Before we move on, please make sure to subscribe to the channel, and you can find the link to get the full course in the description below. 39. What is the main goal of care coordination for a patient with many different health problems? The goal is to connect all treatments, making sure every doctor shares the same patient information. Good communication prevents dangerous medication mixes, keeping the patient very safe across all medical office visits. 40. Why do ambulatory nurses need to review hospital discharge papers during a clinic follow-up visit? Checking the discharge papers ensures the patient understands their new home medications and daily recovery rules. Moving from hospital to home is risky, so reviewing the rules prevents dangerous mistakes from happening. 41. How can a nurse help a patient who does not have a car for their appointments? You can arrange a special medical van, or provide a free bus pass from the clinic. Fixing transportation issues ensures the patient can see the doctor, which keeps their health very stable. 42. What does health literacy mean when we are teaching our clinic patients about their new diseases? It means the patient's ability to read, understand, and use basic medical information to stay healthy. Patients with low health literacy struggle to follow directions, leading to worse overall physical health outcomes. 43. Why should a nurse avoid using very big medical words when talking to a new patient? Big words confuse regular people, making them feel embarrassed to ask for a better, clearer explanation. Using simple language builds strong trust, ensuring the patient fully understands their own personal care plan. 44. What is the most effective way to confirm a patient understands how to use an inhaler? You must ask the patient to show you exactly how they will use it at home. Watching them perform the physical action guarantees they know the correct technique for their breathing medicine. 45. Why is it a huge problem if a diabetic patient cannot afford to buy healthy food? Eating cheap junk food makes their blood sugar rise, leading to very serious internal organ damage. You must connect them with food banks, so they can eat well and safely control their disease. 46. What should you do if you find a broken blood pressure machine in the patient room? You must remove the broken machine immediately, and place a warning tag on the power cord. Taking broken tools out of the room prevents nurses from getting wrong numbers during an exam. 47. How does breaking a large health goal into smaller steps help a very overwhelmed clinic patient? Small steps feel much easier to finish, giving the patient a happy sense of personal success. Quick wins build strong motivation, encouraging the patient to keep working hard on their daily health. 48. Why do nurses collect data on how long patients wait in the lobby before being seen? Tracking wait times helps the clinic find slow processes, allowing us to improve the daily schedule. Shorter waits make patients much happier, improving the overall quality of care they receive from us. 49. What is the first step you should take when helping a newly diagnosed asthma clinic patient? You must teach them what triggers their breathing attacks, like dust, animal hair, or cold weather. Avoiding known triggers stops the bad attacks, keeping their lungs open and feeling much more relaxed. 50. Why is it useful to draw simple pictures when explaining a difficult surgery to a patient? Pictures provide a clear visual guide, helping visual learners understand exactly what will happen to them. Many people process images much faster than words, reducing their fear of the upcoming hospital procedure. 51. How do you respond if a patient says they feel too tired to exercise every day? You should encourage them to start with just 5 minutes of light walking around their house. Starting small removes the heavy pressure, allowing them to build endurance slowly over a few weeks. 52. What role does an ambulatory nurse play when a patient needs to see a heart specialist? The nurse sends the medical records to the specialist, ensuring a smooth and safe care transfer. Sharing the correct documents prevents duplicate testing, saving the patient both time and unnecessary medical pain. 53. Why must we always ask patients about any herbal supplements they take at their own home? Herbal pills can mix badly with prescription drugs, causing very dangerous side effects in the body. Knowing everything they swallow allows the doctor to choose the safest medical treatments for their condition. 54. What is a common sign that a patient might have very low health literacy reading skills? They might say they forgot their glasses, asking you to read the paper form for them. This is a common excuse to hide poor reading skills, requiring you to offer gentle assistance. 55. Why do we teach diabetic patients to check their bare feet every single night before bed? Diabetes causes nerve damage, meaning they might not feel a painful cut on their lower foot. Finding cuts early prevents deep infections, which can unfortunately lead to losing the entire foot later. 56. What should a nurse do when a patient refuses to stop smoking despite having bad lungs? You must respect their personal choice, but continue offering friendly support and quitting resources every visit. Nagging will only make them angry, while offering kind help leaves the door open for positive change. 57. How does a clinic use patient feedback surveys to improve the overall daily medical office operations? Surveys show us what patients like and dislike, guiding the management team to make smart changes. Listening to the patient experience helps us fix bad habits, creating a much better healing environment. Subscribe now and you can find the link to get the full course in the description box below. Welcome back to Section 4, and congratulations on getting one step closer to passing your big exam. Today, we are diving into telehealth and phone triage, which are incredibly popular right now. Because you cannot physically see the patient, you have to listen very closely, ask clear questions, and always follow your approved medical protocols to ensure they stay safe at home. Remember, documenting these calls is just as crucial as an in-person clinic visit. If you do not chart every single detail and the exact advice you gave, legally, the call never happened. Next, we have to talk about the legal and ethical rules that protect both you and your patients. This means ensuring informed consent, respecting a patient's right to refuse care, checking for advance directives, and always advocating for vulnerable people who cannot speak for themselves. Alongside these ethical duties, strict infection control remains a massive part of our job. You must know when to use clean versus sterile techniques, and always dispose of medical waste safely, like putting needles in the sharps box and blood in red bags, to protect the whole community. Finally, you must always be ready for sudden emergencies, because they can happen anywhere, even right in your waiting room. If a patient crashes or has a severe allergic reaction, call for help first, know exactly where your crash cart is, and never, ever leave an unstable patient alone. Staying calm, taking a deep breath, and communicating clearly with your team will absolutely save lives. If you found this lesson helpful, please make sure to subscribe, and grab the full course in the description below to help you ace your exam. 58. What is the most important tool a nurse uses during a telehealth phone triage call? The nurse must use approved medical protocols to guide their questions and patient advice. Protocols are tested safety rules, ensuring you ask the right questions to catch dangerous symptoms. 59. Why is listening so critical when you are talking to a patient on the telephone? You cannot see their physical body, so you must listen for breathing changes or pain. Your ears replace your eyes, helping you figure out if they need an ambulance quickly. 60. What must you do immediately after you finish giving advice on a triage phone call? You must document the entire conversation, including the exact advice given to the sick patient. Writing everything down protects your nursing license and keeps the doctor fully updated on events. 61. What does informed consent mean when a doctor wants to perform a small clinic surgery? The patient must fully understand the surgical risks and agree to the procedure in writing. Patients must know what will happen to them, allowing them to make safe personal choices. 62. What should a nurse do if a patient is forced to sign a surgical consent form? You must stop the process immediately and tell the doctor that the patient feels pressured. Consent must be given freely by the patient, without any threats or pressure from family. 63. Why do we ask older patients if they have an advance directive paper at home? These papers tell us exactly what medical care they want if they become very sick. Knowing their wishes guides emergency care, ensuring we do not perform unwanted treatments on them. 64. What is the main difference between clean technique and strict sterile technique in the clinic? Sterile technique kills every single germ, while clean technique just lowers the number of germs. Deep wounds require sterile tools, preventing dangerous bacteria from entering the inner body tissues. 65. Where should a nurse throw away a paper towel soaked in a patient's fresh blood? Bloody items must go directly into the special red biohazard bag in the clinic room. Red bags warn trash workers about dangerous fluids, keeping everyone safe from catching bad diseases. 66. What is the very first thing you must do if a patient faints in the lobby? You must call out loudly for help, asking another nurse to bring the crash cart. Getting extra help quickly is critical, allowing you to start checking their breathing and pulse. 67. Why do clinic nurses practice fake medical emergencies together on a regular monthly basis? Practicing helps the team move fast, making sure everyone knows their exact job during trouble. Muscle memory takes over during high stress, reducing panic and saving the patient's life faster. 68. How does a nurse advocate for a patient who cannot speak up for their rights? The nurse speaks to the doctor on their behalf, protecting them from bad or unfair care. Advocacy is a core nursing duty, ensuring vulnerable people get safe and respectful medical treatment. 69. What action should you take if a patient has a severe allergic reaction to medicine? You must stop the medicine immediately, call for help, and check their breathing airway fast. Allergies can close the throat very quickly, making oxygen the top priority for the team. 70. Why must you never leave an unstable, very sick patient alone in a clinic room? Their medical condition can get worse in seconds, requiring you to act fast to save them. Staying with them allows you to monitor changes, providing immediate help if their heart stops. 71. What should you tell a phone patient who complains of sudden, crushing left arm pain? You must tell them to hang up the phone and call for an ambulance immediately. Arm pain often signals a massive heart attack, requiring fast transport to a big hospital. 72. How do you confirm the identity of a patient before you start a telehealth video call? You must ask them to state their full legal name and their exact birth date. Checking two personal identifiers prevents you from discussing private health matters with the wrong person. 73. What is the best way to handle a patient who refuses to sign an advance directive? You explain that it is completely optional, and you document their refusal in the chart. Patients have the right to decline paperwork, and we must respect their personal legal choices. 74. Why is clear communication so critical when handing a patient over to the ambulance crew? The crew needs accurate facts about the patient's condition, so they can continue safe treatments. A good handoff prevents medical mistakes, ensuring the transition of care is smooth and safe. 75. What should you do if you notice a colleague breaking a sterile field during a procedure? You must speak up immediately, telling him the field is contaminated and needs fixing now. Protecting the patient from infection is your main job, even if correcting a coworker feels awkward. 76. How does a nurse properly document a patient refusing a recommended life-saving treatment plan? You write down that the risks were explained, and the patient clearly refused the care. Detailed notes prove the medical team did their job, protecting the clinic from future lawsuits. Welcome back to Section 5, where we will dive into caring for young children and managing women's health needs. Since children are not just small adults, their growing bodies require special care, like accurately monitoring their growth charts and giving essential immunizations with a gentle, comforting approach. For women's health, our focus shifts to preventive care, encouraging routine mammograms and pap smears, while always ensuring our patients feel safe, private, and comfortable during their visits. In the ambulatory clinic, managing chronic pain is a major part of our job, so we use pain scales, physical therapy, and safe medications to help improve their daily life. We also focus heavily on patient education, teaching them how to read nutrition labels, stay properly hydrated, and use peak flow meters to monitor their asthma at home. Additionally, we perform simple allergy tests to pinpoint what causes their sickness, and we routinely check for skin issues, reminding them to watch for dangerous new moles and to always wear sunscreen. Finally, we educate our patients on safe exercise routines, like daily walking, while reminding older patients to stay cool and rest indoors during hot weather. You are learning so much, and you are truly on your way to becoming a wonderful clinic nurse, so let's jump right into the next set of questions to test what we just covered. Before we do, please make sure to subscribe to the channel, and you can find the link to get the full course in the description box below. 77. Why do clinic nurses plot a young child's height and weight on a growth chart? Plotting these numbers shows us if the child is growing normally compared to other kids. A sudden drop in growth warns the doctor that the child might be very sick. 78. What is the best way to distract a young child while giving him a painful shot? You can use a brightly colored toy or blow simple bubbles to catch their attention. Distraction takes their mind off the pain, making the scary injection process much faster. 79. Why do we tell women to get a regular mammogram test every single year? Mammograms find tiny breast cancer lumps, catching the bad disease before it grows very large. Finding cancer early gives the patient a much higher chance of surviving the scary illness. 80. What should a nurse do to make a patient comfortable before a cervical cancer screening? You must provide a warm robe and give them a private room to change clothes. Making them feel safe and respected reduces their deep anxiety about the uncomfortable physical exam. 81. How do we help a patient explain their hidden pain level to the medical doctor? We ask the patient to rate their current pain on a scale from 0 to 10. Using a simple number helps the doctor decide which strong medicine will stop the pain. 82. Why is physical therapy a good option for a patient dealing with very chronic pain? It strengthens weak body muscles, reducing pain without using highly dangerous and addictive drug pills. Natural healing methods are much safer, protecting the patient from terrible side effects and addictions. 83. What is the main reason we teach patients how to read grocery store food labels? Reading labels helps them find hidden sugars, guiding them to make much healthier food choices. Good nutrition acts like powerful medicine, keeping their blood sugar and weight very stable. 84. Why do we tell all our clinic patients to drink plenty of fresh water daily? Water flushes bad waste from the body, keeping the internal organs working smoothly and safely. Staying hydrated gives patients more energy, while also preventing painful kidney stones from forming. 85. What does a peak flow meter measure for a patient who suffers from severe asthma? This small tool measures their breathing power, showing how well their lungs push air out. Dropping numbers mean their airways are closing, telling them to use an emergency rescue inhaler. 86. Why must you watch an asthma patient use their peak flow meter in the clinic? Watching them perform the test confirms they know the correct technique for accurate lung numbers. Poor technique gives wrong test results, which can lead to very dangerous medical treatment errors. 87. How can patients protect themselves from getting bad skin cancer during the hot summer months? They must apply strong sunscreen every day, and wear hats when sitting in the sun. Blocking the harmful sun rays stops the skin from burning, preventing dangerous cancer cells from growing. 88. What should a patient do if they notice a dark skin mole changing its color? They must call the clinic immediately, asking the doctor to examine the strange changing spot. Changing moles often indicate fast-moving skin cancer, requiring very quick medical removal and testing. 89. Why do nurses place small drops of liquid on a patient's arm during allergy testing? The drops contain tiny amounts of allergens, allowing us to see what causes a reaction. Red bumps show us what the patient is allergic to, guiding their future treatment plan. 90. What must you watch for when testing a patient for severe seasonal outdoor plant allergies? You must watch their skin very closely, looking for red bumps or very itchy patches. These physical signs prove their body hates the substance, confirming the exact allergy diagnosis perfectly. 91. Why is it helpful to give a child a sticker after a scary medical visit? A small reward makes them smile, turning a bad memory into a very happy experience. Happy children trust the nursing staff more, making their next clinic visit much easier. 92. What should you do if a patient refuses to step on the clinic weighing scale? You must gently accept their choice, writing their refusal down in the official medical chart. Patients have the right to refuse anything, and we must always respect their personal boundaries. 93. How do heat and ice packs help a patient suffering from a very sore back? Ice reduces painful swelling quickly, while heat relaxes the very tight muscles in their back. Alternating these simple treatments offers fast relief, without causing any bad stomach side effects. 94. Why do we ask parents about the young child's daily eating and snacking food habits? Poor diets cause slow physical growth, so we must make sure they eat healthy vitamins. Finding diet problems early helps us teach the parents, getting the child back on track. 95. What is the most reliable way to know if a patient is truly in pain? The patient's own words are the best proof, so we must always believe their report. Pain is a personal feeling, meaning only the patient knows exactly how much they hurt. Welcome back to Section 6, the final part of our nursing study course. You have worked so hard to get here, and I am incredibly proud of you. In this section, we will focus on clinical leadership, ensuring your entire team works seamlessly together. A great clinic nurse acts as a strong guide, helping new nurses learn the ropes and gently correcting mistakes to keep patients safe. Remember, we must always follow clinic policies and report any broken equipment immediately, stopping accidents before they can even happen. Next, we need to talk about safety, starting with disaster planning and knowing your evacuation routes. Medication safety is also a constant priority, requiring you to double-check every single pill, verify patient identities, and always call the doctor if an order is confusing. To provide the best care, we rely on evidence-based practice, meaning you should constantly read medical journals to keep your skills sharp. Additionally, while electronic health records make our jobs easier, you must always log out of your computer, ensuring private patient data stays strictly protected. Finally, never forget that self-care is crucial, because you simply cannot pour from an empty cup. Take your breaks, rest your feet, and lean on your nursing friends when you feel stressed, so you can give the absolute best care possible. You are now fully ready for the final test questions, so take your time, read carefully, and trust your gut. Before we jump into the exam, please make sure to subscribe to the channel, and remember, you can find the link to get the full course in the description box below. 96. What is the best way for a nurse to teach a brand new clinic worker? You must explain the rules clearly, letting them ask questions without feeling silly or dumb. Supporting new staff builds their confidence quickly, making them a much safer nurse to patients. 97. Why do we always double-check a confusing medication order with the main clinic doctor? Guessing a bad doctor order can cause a fatal mistake, hurting the sick clinic patient. Clarifying orders prevents terrible drug errors, ensuring the patient gets the correct safe pill dose. 98. What should a nurse do immediately after discovering a broken wheelchair in the waiting room? You must move the broken chair away, placing a warning tag on the broken seat. Removing broken tools stops patients from falling down, preventing bad injuries inside the medical clinic. 99. How does an electronic health record improve patient safety during a busy daily clinic shift? The computer system warns the nurse about bad drug allergies, preventing a dangerous medical mix. Digital alerts catch small human mistakes quickly, keeping the sick patient safe from bad reactions. 100. Why is it required to practice fire drills with your entire clinic team every month? Practicing the fire exit plan builds strong muscle memory, stopping panic when real fire happens. Moving fast during a big disaster saves lives, helping everyone escape the burning building safely. 101. What is the main reason a nurse must take regular rest breaks during their shift? Resting your body reduces extreme mental stress, preventing dangerous burnout from ruining your nursing career. Tired nurses make bad medical mistakes easily, so taking breaks protects the sick clinic patients. 102. How does evidence-based practice change the way we treat our patients in the modern clinic? We use the newest proven science to guide care, throwing away old and unsafe habits. Following fresh medical research ensures patients receive the best healing treatments available in the world. 103. What action should you take if you see a coworker acting very rude to patients? You must report the bad behavior privately, telling the clinic manager about the rude words. Protecting patients from emotional harm is required, ensuring they feel respected during their sick visits. 104. Why do clinic nurses read new medical journals every single month of the calendar year? Reading new articles keeps your brain very sharp, teaching you fresh facts about new diseases. Medical rules change very quickly over time, so continuous learning makes you a great clinic nurse. 105. What is the correct way to handle a patient who arrives very late for appointments? You must explain the strict clinic schedule kindly, asking them to come earlier next time. Setting polite boundaries keeps the daily schedule running smoothly, reducing the wait for other people. 106. Why is it bad to share your secure computer password with a new nursing coworker? Sharing passwords breaks federal privacy laws, putting the patient's secret medical history in great danger. You are legally responsible for your account, so keep your secret password hidden from everyone. You can find the link to get the full course in the description box below.